Welcome to Behind the Headlines, the weekly news roundup from Utah Public Radio and the Salt Lake Tribune. I'm Tom Williams. How Republicans' cuts to the Affordable Care Act may affect Utahns' health care. A federal judge issues a first ruling in a bellwether trial over Utah's claims to thousands of roads on federal land. And the state's 140-year-old mental health hospital is now on coveted Utah County land. Here's who wants a piece of it. Joining me today are Salt Lake Tribune State Watch reporter Addy Baird. Addy, thank you for joining us.
Hi, good to be here.
Thanks for being with us. Water and land use reporter Leia Larsen is with us. Thank you.
Yeah, good morning.
Good morning. And later in the program, we'll hear from reporter Paighten Harkins. So, Addy Baird, let's start with you. We're talking, of course, about the so-called Big Beautiful Bill, how this may affect health care in Utah. So I guess that's a place to start. I guess we've heard about the changes potentially to Medicaid also affecting Affordable Care Act.
That's right. The changes to Medicaid have gotten a lot of attention, and rightfully so. But actually, some of the biggest possible healthcare losses under this so-called Big Beautiful Bill come from changes to the Affordable Care Act, and importantly, also come from what has been left out. A lot of people thought that if Congress was going to extend the enhanced premium tax credits, which are tax credits that help millions of Americans afford marketplace health care, that if they were going to extend those credits, which expire at the end of the year, that they would do it during the budget reconciliation process, and they were not included in this bill. So there's technically still time for those to be renewed, but if we get to the end of the year without that renewal, it's going to be an even bigger coverage loss than anticipated right now.
So these, you call them enhancements, I guess some extra money to help people pay for insurance. This happened around COVID time? It's my vague
Correct.
memory. Yeah, tell us about that.
Correct. So the Affordable Care Act has always had premium tax credits to help people afford marketplace health care. Originally, those tax credits were only available to people making up to 400% of the poverty level. During COVID, there were enhanced premium tax credits introduced, which expanded how many people are eligible for credits for marketplace healthcare. So people making more than 400% of the poverty level were suddenly able to have this credit to afford marketplace healthcare. And so they were a COVID era credit originally, but what we saw with those credits was that marketplace enrollment essentially doubled. There had been about 11 million, a little more than 11 million Americans enrolled in ACA coverage. And with the introduction of the enhanced credits, we now have nearly 25 million Americans using the marketplace to get their health insurance.
So how many people do we estimate, do we think might opt not to get insurance? It becomes too expensive.
So in the state of Utah, we're looking at something like 70 to 100,000 plus people who could lose access to coverage under the Affordable Care Act because of the changes to the ACA. Across the country, under the Big Beautiful Bill, the estimates are anywhere from 10 million to 17 million people who could lose access to their health insurance between changes to the ACA and changes to Medicaid. And again, the changes to Medicaid have gotten a lot of attention. There are something like 4 or 5 million Americans who are relying on that, who, because of the changes with increased eligibility checks and the imposition of work requirements, could lose access to that program. And that program covers some of the most needy and vulnerable populations. But again, some of these really big mass losses are going to come from ACA coverage. Again, something like 10 to 17 million Americans could lose their healthcare coverage under this bill.
So I guess if a household or a person decides without this extra money can't afford to go on the market and get health care, then they're back, I guess, to skipping doctor visits, right? And not getting their prescriptions and those sort of things.
Exactly. Exactly. And there's a lot of research about how damaging being uninsured can be for people. Governor Cox spoke to this actually, who, of course, is a Republican, and this is the Republican budget. But he addressed this at his own media conference last week, a couple weeks ago. I can't remember exactly when that was, but he basically said, we pay for the healthcare of people no matter what. If people don't have health insurance and they don't go get preventative care, they don't go to a doctor's appointment, they end up in the ER, which is where we get the most expensive healthcare, and it's where we all, as a collective, as a state, end up paying for it no matter what. So it's a tricky situation, and our legislative leaders have said that it's something that they're watching. Um, but we'll see what happens. One of the tricky things at this moment is that even though there's technically still time for Congress to extend the enhanced credits, insurers are already setting their rates for next year, and they are assuming that the credits will not be renewed. So we are going to see already increased premiums and higher costs for healthcare consumers because Congress didn't make these changes. And the lack of the enhanced premium tax credits isn't the only change to the ACA. They have also tightened the screws on who is eligible. Previously, it was much easier to simply auto renew your marketplace coverage. That's no longer going to be true. So it's a lot more red tape across the board for people who get their coverage through the ACA.
Now you talk about small businesses in your story. This is going to hit small business, and Utah, you point out, is pretty much all small business. I mean, that's exaggerating a bit, but it's a high percentage of businesses are small businesses in Utah.
Yeah, it's barely exaggerated. It actually shocked me. Something like 96% of Utah businesses are considered small businesses. We are a very, very small business dense state. And many small businesses rely on the ACA to get coverage for their employees. It's expensive to get private insurance for your employees. And so a lot of businesses essentially use the marketplace to have their employees get coverage and then they're reimbursed. And they will also rely on these enhanced premium tax credits. And of course, they are also affected by these other changes like renewals and eligibility issues. So it is going to take a hit on the small business community that relies on this to cover their employees. And like you mentioned, like we started here, Utah's a very, very small business dense state. There are also new restrictions on immigrants and which immigrants are eligible for ACA coverage. Fewer types of visas and immigrants are able to have marketplace coverage. So we're going to see an effect on our immigrant community and our immigrant-owned small businesses here in the state.
One of the people you talked to had a hypothetical situation. I'm just going to read this. A hypothetical situation: husband and wife own a business together and use the marketplace to enroll themselves and their two children, estimating that their income will be 395% of poverty level. That's allowed once these tax credits expire. But instead, at the end of the year, it turns out to be 405%. Of course, 400 and above 400% is not allowed with the loss of these tax credits. So what would happen in that case? I guess there's some jeopardy there if you're right on the line.
Absolutely. In that case, and there is a bit of range state by state here, but generally in this hypothetical, that husband and wife would owe the government about $30,000. And there have previously been some easier ways to kind of reorder on the back end if you estimate your income incorrectly, which for many people who are small business owners or people who are self-employed, estimating your income is not easy. And the difference between just under and just over that 400% of the federal poverty level could be the difference between owing the government nothing and $30,000 and being blocked out of further subsidies until you pay that back.
So this calculation, I guess, small businesses will have to make going forward.
Absolutely.
Yeah. One final thing on this. I guess Congress, if they wanted to, Congress could extend those tax credits, but no current plans that I've heard.
They could still extend them. There has been very little engagement on the issue, frankly, from our federal delegation. I reached out to all of them asking if it was something that they supported, if it was something that they planned on pushing, and none of them wanted to comment on that. Tom Tillis, who is a Republican senator who voted against the Big Beautiful Bill, has said that he thinks that the party should join with Democrats and extend the enhanced tax credits, but that is not a song or a tune that we're hearing from many other Republicans in Congress.
State Watch reporter Addy Baird been telling us about this. One more story here we have time for, I believe, Addy. Here's the headline. Trump's DOJ wants Utah voter data. Lieutenant Governor Henderson says they need a lawful purpose. So you did the stories along with Robert Gerke and Emily Anderson-Stern. What is the Department of Justice looking for?
Yeah, the Department of Justice is on a mission to force the state to hand over their voter database, essentially. It's not just Utah that they're targeting. They are hoping to get this data from a number of states across the country. And this is all part of the conspiracy theory that Trump has been weaving for years, that there is mass voter fraud around the United States, particularly voter fraud among non-citizens. And the Department of Justice about 2 weeks ago wrote to Lieutenant Governor Deidre Henderson and said that they wanted the voter data for the state of Utah. And the Lieutenant Governor responded yesterday and gave them only data that is publicly available.
And Lieutenant Governor has been pretty outspoken on this, right? She says elections are run well in Utah. She doesn't appreciate aspersions being cast.
Yeah, she's been pretty outspoken on this for a Republican lieutenant governor for sure. But she's been very, very diplomatic compared to some of the other states that have had
That's
this
true.
request.
Yeah. Tell us what the Maine official in Maine said.
Yes. The Maine Secretary of State, her name is Shetta Bellows, said the Gulf of Maine is awfully cold, but maybe that's what the DOJ needs to cool down. So here's my answer to Trump's DOJ today. Go jump in the Gulf of Maine. So compared to that, our lieutenant governor was very diplomatic in that she said, we follow the law, we have strong election systems, the information that you have is incorrect, and here is the publicly available voter data. It is a really big deal that she did not give the DOJ all of the voter data for the state of Utah, which would have included personal information like social security numbers. What she handed over was only public data that's available to, say, candidates or political parties in the state already.
Representative Blake Moore, I guess, made a comment on this. He's supporting the lieutenant governor.
Yeah, Representative Blake Moore is notably Utah's only member of congressional leadership. He's the vice chair of the House Republican Caucus. And he was in South Ogden earlier this week prior to Henderson's response to the DOJ, and he got asked about whether he believed it would be appropriate for the state to hand over voter data to the feds. And Representative Moore said that he deferred to Lieutenant Governor Henderson on that, and that he thinks that Utah has done a really great job in the way that we handle our election systems here in this state.
And you note in your story at the end, Senator Lee is sponsoring a SAVE Act. He's concerned about non-citizens potentially voting.
That's right. Senator Lee has made this issue one of his legislative priorities. The SAVE Act stands for the Safeguard American Voter Eligibility Act. It would require that voters produce evidence of citizenship when they register to vote or update their voter registration. And this bill is absolutely based in and born of conspiracies about voter fraud and mass non-citizen voting in the United States. And a lot of experts told me several months ago when I originally wrote about the SAVE Act that it will ultimately make it harder for many citizens to vote. And I want to note as well that the information that Lieutenant Governor Henderson gave to the DOJ yesterday included how many non-citizens have been found on the voter rolls in the state of Utah. And again, there are millions of voters in the state of Utah. There were 4 non-citizens that were found and removed from the rolls. So even the evidence that we have of non-citizens registering, it is a minor, minor, minor percent of the population, and they are removed from the rolls. It's not the mass conspiracy that Senator Lee and others have claimed.
Well, we've been talking with State Watch reporter Addy Baird. Addy, thank you.
Thank you.
And following a break, we'll be talking with water and land use reporter Leia Larsen. You're listening to Behind the Headlines, the weekly news roundup from Utah Public Radio and the Salt Lake Tribune. We'll have more following this. You're listening to Behind the Headlines, the weekly news roundup from Utah Public Radio and the Salt Lake Tribune. I'm Tom Williams. Here's the next headline. A federal judge issues a first ruling in a bellwether trial over Utah's claims to thousands of roads on federal land. And we bring in now Salt Lake Tribune water and land use reporter Leia Larsen. Leia, thank you.
Yeah, thank you.
So, this is interesting. This has been a long struggle between state and the federal government, right? These roads, or I guess as environmentalists would put it, I'm doing air quotes, roads. This is the famous RS 2477. Tell us what that is.
Yeah, so it's it's a repealed provision from the old 1866 Mining Act, where the federal government was trying to open up the West to development and to settlement. So under RS 2477, they kind of had a free-for-all where communities could build roads over public lands to do just about anything, from like logging to mining to homesteading. If someone wanted to build a road, they could just lay one down, and that was that. However, after 100 years of use and kind of overuse in the West, Congress decided to rein things in, and in 1976 passed the Federal Land Policy and Management Act, which closed a lot of the practices Westerners have been used to, and like kind of the free-for-all. So reined all that in, repealed the RS 2477 provision. However, they did allow existing roads to be grandfathered in, as long as it could demonstrate continuous, at least 10 years of continuous use, and that it, met that definition of like a public highway. So not just a rancher using it for his own personal use, but, it would have to be a public highway. So that's kind of where we are today. And when this little provision was first repealed, it didn't make so much of a splash as like restrictions on grazing and mining and things. But I think my suspicion is it was kind of the rise of ATVs and off-roading recreation that kind of like brought this to the forefront of Utah's attention, and they started following all these lawsuits in the 2010s, and that brings us sort of where we are today, where things have been slow moving. Even though Utah filed all these lawsuits more than a decade ago, we haven't seen a lot of traction yet. But this decision late last month kind of represents the first small step, I guess, toward a resolution.
So these are more than 12,000 roads that are in dispute, right? Tell me about the bellwether is the word we're using here. That's the word the court is using. Tell me about that. How I guess they're using just a handful of roads as a kind of a test case.
Yeah. So like you said, 12,000 roads across the state, just like this vast spider web of roads over like pretty much every rural county statewide. So that's a lot for the courts to sift through. Pretty overwhelming. So what they opted to do was take 15 cases in King County alone as their quote unquote bellwether cases, like you mentioned. And then after hearing some oral arguments in 2020, they added another road in Garfield County as their bellwether cases. So that's what the court's going to decide on for now, to kind of create a roadmap in how they adjudicate these other roads moving forward. So I think they show though just like how long and slow this process has been because the state first filed its lawsuits for all these 12,000, I think it's closer to like 12,500 roads across the state back in the 2010s. They started sifting through them, finally had oral arguments in 2020, and here we are 5 years later, and they're finally making a very small decision on just two of those roads. So, yeah.
So I guess the news here is that what did the judge decide on those two roads?
So the judge decided that two roads, or maybe probably better said sections of roads, do meet the definition of a highway, as the state has argued, and those are Hole in the Rock Road, the portions that go through Kane and Garfield County, as well as House Rock Valley Road in Kane County. So those two roads out of the 12,000 that they have to determine and sift through, those two, they've decided, yes, they do meet the definition. However, this decision will almost certainly be appealed by environmental groups and probably by the federal government. So nothing's fully decided yet, I would say.
And the judge did say, don't take this as a harbinger of the way I'm going to rule on the other, I guess, 13 roads, right?
Exactly. He indicated that a much lengthier memorandum is coming that will both explain his legal reasoning for ruling on these two roads, as well as his determination on the other bellwether roads. So we don't know when that's coming, but could be the end of the year, could be another 5 years, but it feels like we're getting close. Feels like we're getting close.
Now, this is the whole debate in microcosm, I think, isn't it? These roads. So, tell me first about what the state and the county is saying. Why they feel they need these roads.
I think they have several arguments. They say like from the beginning, the reason these roads were constructed was because rural counties need this vital access to not just like mining claims and logging claims, but for public safety, to manage wildlife. And then I think their case has kind of evolved a bit as well. Now they're saying that it's important for recreation access. There's a lot more ATV owners than ever before, and these ATVs can go a lot farther than they've ever had to before. So I think the state is really making a case for recreation. But they do harp on like the public safety aspect, and if there's wildfire or if they need to manage wildlife, these roads are important to rural counties.
What do environmentalists say?
Well, I think the environmental groups that are involved in this case anyway, like I don't think that they would disagree with all of the roads being highways that the county should have some ability to maintain and access. But I think that they would argue that the vast majority of these go too far. Like they're just cow paths. They're two tracks in the desert. There may be like a small path that somebody used to stake a mining claim in the 50s and then never went back. So not really the definition of a highway with continuous use over 10 years. And I think crucially, a lot of these roads pass over stream beds. And with this rise in motorized use, ATVs that, they can leak oil and hydrocarbons and create a lot of damage actually when they go off road or through stream beds. So I think that environmental groups are concerned about that. I think they're worried this is an overreach. A lot of these roads were actually built after the fact, after the 1976 Federal Land Policy Management Act, in order to prevent wilderness areas and roadless areas. So I think that would summarize their concerns for the most part.
All right. Well, thanks for telling us about this, Leia Larsen. I'd like to fit in. We have a little bit of time here. Your story on the Great Salt Lake. Here's the headline. Great Salt Lake again dips to scary low level. That quote, scary low level, that's the Great Salt Lake Commissioner, I think, talking about it.
Yeah, he had a media event with reporters this week, Brian Steed, the Great Salt Lake Commissioner, and like, yeah, those were his words. We are 2 feet lower on the Great Salt Lake than we were at this time last year, which is, quite a difference. All those gains we got in 2023 in our record high snowpack have been wiped out. We're kind of right back where we were during those scary years where the lake was teetering toward an all-time low. And meanwhile, we've only made like the tiniest of gains in securing water to flow to the Great Salt Lake. The Division of Water Resources put out a news release update about a week and a half ago talking about reservoir levels, how our reservoirs are still healthy, but there's some indication that Utahns are back to maybe overconsumption of water. Reservoirs are down 10% over the last month, whereas usually this time of year would be about 2%. So water consumption is up. The Great Salt Lake is still struggling. We're kind of back where we were just a few years ago when everyone was super worried about the lake shrinking to unsustainable levels.
Again, and the water level is just not water level alone, right? If the level sinks low enough, you get salinity increases, right? That affects the ecological health of the lake.
Right. Yeah. So where we are right now, we're kind of at the tip of this red zone, like this scary level for the lake where, like you said, salinity spikes, which is not great for the brine shrimp and the brine flies that so many birds depend on. But not just that, boats can't launch from the marinas, including rescue boats. Phragmites start to invade wetlands because water levels are so low. All kinds of issues come up because of this, like entering into the scary red zone, which we're teetering into now.
How far are we away from the level where they would fill in the causeway?
Just 2 feet. Yeah, that's a great question. Just 2 feet. So probably won't hit that level this year, but next year, depending on what the winter looks like, is a really real possibility where they'd fill in the causeway, like you said, that divides the lake into two, kind of seals off the saltier north arm from allowing its salt to migrate to the south arm and spike salinity there. The south arm is where the most productive ecological functions are. But like we saw in 2022, kind of the tail end of 2022, the salinity levels were so high, the brine flies had all died off, which was really, really scary. So they filled in the causeway to prevent that salt from migrating from the north, and it did help. So at 4190, which we're 2 feet from that, they'll fill it in again. So that's where we stand.
Okay, and Commissioner Steed, I guess his main message is conservation to all of us.
Yes, absolutely. I mean, as our reservoir use shows, Utahns, including those in cities, watering their lawns and such, are their water use is up, and we really need to rein that in, like we did in those scary low years, if we want the lake to recover. But of course, agriculture it has a role to play here. So I think they're working hard there to find farmers willing to lease part of their water for part of the year to help the lake keep it or bring it back up to at least a somewhat sustainable level. So we all have a role to play.
Yeah. Well, Water and Land Use reporter Leia Larsen, thank you.
Yeah, thank you.
We have time just for a quick underplayed stories of the week. Let's start with Addy Baird. What's your underplayed story of the week?
What is happening in Gaza has gotten a lot of attention. I think it's, maybe difficult to say it's underplayed, but I kind of think it is. The story I wanted to point out specifically was a really heartbreaking and beautiful story in the Washington Post yesterday. The headline was 60,000 Gazans have been killed. 18,500 were children. These are their names. And it is a long and heartbreaking list of the 18,500 children who have been killed in Gaza. And it's pretty moving and heartbreaking to scroll through.
Okay. Yeah, thanks for pointing that one out. Leia Larsen, what's your underplayed story of the week?
Mine is by my colleague Julie Jag. She wrote about Park City mountain resorts. Their summer workers are looking to unionize. I think we all remember in the winter when the ski patrollers and winter workers unionized and went on strike and caused all those disruptions during the peak of ski season. Now it looks like their summer workers that are working on like the mountain bike trails and things are taking a page out of their book, and they're also forming a union. So,
okay, sltrib.com for that and everything we've been talking about today. Well, we've been talking with Salt Lake Tribune State Watch reporter Addy Baird. Addy, thank you so much.
Thank you, Tom.
Thank you. And Water and Land Use reporter Leia Larsen's been with us. Thank you.
yeah, have a good weekend.
You too. Following a break, we will continue the program with a recorded conversation with Paighten Harkins. Here's the headline. The state's 140-year-old mental health hospital is now on coveted Utah County land. Here's who wants a piece of it. We'll have more on Behind the Headlines, the weekly news roundup from Utah Public Radio and the Salt Lake Tribune following this. You're listening to Behind the Headlines, the weekly news roundup from Utah Public Radio and the Salt Lake Tribune. I'm Tom Williams, and this part of the program, we bring in Salt Lake Tribune reporter Paighten Harkins. Paighten, thanks for joining us.
Of course, thanks for having me.
So we want to talk about this story among a couple of others. Here's the headline. The state's 140-year-old mental health hospital is now on coveted Utah County land. Here's who wants a piece of it. So we've been hearing rumblings right about this. There's been various legislators, public officials. I guess it's coming up again. Let's go back and do a little bit of history, as you do in the story. When it was instituted, it was called the Territorial Insane Asylum. Things have moved on, of course, with the terminology we use, right? 140 years ago. So what year was that?
1885.
Yeah.
Should be.
So tell me about Provo of that time.
Yeah, my understanding of Provo back in 1885 was that it was a mostly, sort of agricultural focused community. There were a lot of farmers essentially, and all of those farmers were utilizing farmland sort of west of what we know as I-15 now. And so when you think about Provo now, it's like, the west side of the city is kind of the one that doesn't have, as much stuff as the east side or whatever. But apparently back then it was, kind of the opposite case. And so when, our leaders at the time, I guess of the territory, when they were trying to find a place for, what they called the insane asylum, they wanted to put it actually not in Provo. That's another interesting story, but they chose Provo because, it was a day's journey from Salt Lake, and this land sort of up near the foothills on the eastern side of Provo now was just swamp. It was kind of land nobody wanted. There was also at one point a dump there. There was a lot basically that separated, the town from the insane asylum, and they put it there, kind of to keep some distance from these people. And, obviously that land did not stay secluded. It ended up being very important, very, very valuable land, which is how we kind of get to where we're at today.
So fast forward 140 years, this land's become valuable, right? I guess a lot of building up east into the foothills, right? Houses, other things. And as we're aware, right, there's now a popular water park right smack dab next to the mental hospital.
Yeah, it's kind of interesting if you've ever gone out to the state hospital grounds, and there's more than just a state hospital out there. There's also a disc golf course on the grounds and stuff like that. So there is a reason why the public would want to go out there. But it's like you look, kind of at the neighbor, and you see these colorful water slides kind of, coming out of the trees and stuff. And it's just an interesting juxtaposition. But yeah.
So going back to 140 years.
Mm-hmm.
This was seen as a kind of a coup for Provo, right? Salt Lake City got the capital. Provo was leaders saw this as this is going to be an economic benefit to the area.
Yeah, because like I was saying earlier, they their primary economy at the time was this farmland, and it's like, I mean, even I guess back then it's like you couldn't make a ton of money on just doing that, and so they wanted to bring the hospital in to provide jobs for people, for nurses and doctors and things like that. And so, they had planned on putting the state hospital where the state capital was going to be at the original state house in Fillmore, but they decided not to. Apparently, Utah County politicians even back then had some political sway and were able to, convince the, territorial lawmakers at the time to put it in Provo. And so they did. And for a long time, it was kind of its own sort of self-functioning sort of city within a city. They did their own agriculture out there. Apparently it's a pretty long journey by horse to get from one side of Provo to the other, so they kind of had to be self-sufficient.
So fast forward to today, leaders are saying that they don't think it's a huge economic impact to have the state hospital in Provo.
Yeah, I mean, and they, the people that I talked to, and the person that said that was Utah County Commissioner Amelia Powers Gardner, and she was also the one that sponsored this resolution that Utah County Commission did that said basically, we're interested in looking into, options to sell the land beneath the state hospital and, do a sort of statewide mental health system, so it's like if you have a loved one, you're from St. George or something, you could maybe receive this level of care, closer to home instead of having in Provo. But yeah, she was saying that, she acknowledges that, the state hospital still creates jobs. People, still work there. It's a good learning opportunity for folks that go to UVU or BYU and want to go into, careers like this. But she just thinks doing the cost benefit analysis that you can probably get more money and help the system, expand and grow and stuff like that if they were to sell this land and use the money for something else.
So even the officials who want to move the hospital, they're saying, well, let's focus on the patients, right? Let's focus on the folks who have mental health issues there. So one of your subheadlines is what the hospital does. Tell me what the hospital does at this point, how it fits into the system.
Yeah, so I mean, for the longest time, the state hospital was basically the place for, individuals that needed sort of inpatient high levels of treatment for mental illnesses. And that was all the way until, I want to say the mid 50s is when that sort of started to change. And then it was more, they called it at the time like a human warehouse, and so from then until 1969, they began to kind of learn about therapeutic, treatments, kind of more modern day mental health, solutions and things like that. And then in the, 69 is when Utah as a whole just kind of changed how it does its mental health care. And so instead of having this one like state center that was the epicenter of all mental health care in the state, they split it up into sort of regionally located mental health providers. And so that's how you get, like Salt Lake Behavioral Health or Davis Behavioral Health, all these sort of regional ones. And so now, those and other sort of local providers would be your first step. But you get some people that, their challenges are far more severe for what, those local groups can handle. And so those are the folks that end up getting sent to the Utah State Hospital. And, there's juveniles, like children are here, and then there's adults that have been like civilly committed, and then there's also the forensic side, which those are the people who, have been convicted or in the process of going through legal proceedings of doing some kind of crime. And then, they stay at the hospital until they can be restored to get their sentence, essentially.
Is there, I guess at some point there was a pretty long waiting list to get in. How's that now?
In about 2015, the Disability Law Center, they sued the state and the state hospital because they were saying that there were people in jails who, were people that, are not competent, they can't continue their legal proceedings or whatever. They were just sort of languishing in jails instead of being able to go to the state hospital. There was like, 100 people wait list or something like that. And so they tell me fixed those wait list issues. They settled with the Disability Law Center, and they tell me that the wait list now is weeks, like if that, and there's still a shortage of forensics beds, they told me, but they're hopeful that the legislature will give them some more money to build about, I think 60 more beds is what they need.
No, Utah County Commissioner Amelia Powers Gardner, you've talked about her, she's in the story. She recounted a story of a friend of hers from St. George had somebody, I guess a family member with schizophrenia. That's a pretty long trip, right? So she used that as an example of why I think she wants this to be more regional, split the central location state hospital into several, I guess.
Yeah. And she was saying if her friend's son does end up getting a bed at the Utah State Hospital in Provo, this friend has asked her, can you be the one that goes and visits him? Because it's just, you'll be able to get up there more often than I will type thing. And it's, that's a concern others have had, just how far away Utah County is from some of our more rural parts of the states, both north and south side of the states, But, talking to the other side of things, like the state hospital superintendent and stuff like that, it's just so much money, they say, has been put into this campus in Provo that they just don't know that even with this huge windfall they would expect to be getting from selling the property that they would ever be able to replicate, the state-of-the-art facilities that they have at the Utah State Hospital. So that's kind of there's a give and take there.
Yeah, the superintendent, the director, I guess, there says you'd never be able to replicate this, right?
Yeah, because I mean, you can imagine the land that is available to purchase right now is certainly not, that the state would be willing to purchase, being maybe frugally minded. They would not be able to find open land in the foothills of a major city like they have now. It's just kind of they wouldn't be able to find that. So yeah, I'm kind of I can see Dallas Earnshaws' point there. It's like I don't know that they could replicate it either unless they put it somewhere maybe more rural.
Mm-hmm. Now, this has come up with the legislature, I think, the last couple of years. Of course, the Utah County Commission, I think, passed a resolution. And these officials are, the commissioner made sure to say that she's been thinking about the health of the the patients there, but they all acknowledge, well, there's a lot of pressure that a lot of people want this land.
Yeah, and it seems, and I know of at least one group that wants the land, and I'm certain there's probably others, but Splash Summit, which is that water park we were talking about, that's next door to here. They were apparently the group that approached one of our lawmakers back in I think in 2023. That legislative session. That was when the first bill that I can remember covering came out about this, and it was mulling a cell, the same sort of thing that we saw the next year from another rep, Tyler Clancy, and then Tyler Clancy's bill ended up, it was kind of the part about selling the hospital was removed, ended up being just a study of, not necessarily even a feasibility study. I think they were just looking at forensic beds and civil commitments and things like that because there's real problems there. And so that ended up just turning into a study. So neither of those bills really went anywhere in terms of selling, the state hospital property. But then in February was when the Utah County Commission did their, their resolution wanting mulling the cell is how I've been kind of putting it. They don't really want the cell. They've been thinking about selling it, what that would entail, all that stuff. And so, we're supposed to be getting results back from that study that Tyler Clancy bill, provided for. We're supposed to get that in interims next month. So, I mean, more news to come. Right now, it's just kind of in a holding pattern. And I don't know what Splash Summit wants to do. They've been looking at another piece of land, but that seems to not be happening. So yeah, maybe they go back to Utah State Hospital. I'm not certain.
There's an interim session coming up, I think, right? To the legislature.
Yeah.
Anything concrete expected to happen there, or they'll just review the results of the study? What's going to happen there?
Yeah, my understanding is they're going to review the results of the study, and then Clancy told me that they're also going to be looking at maybe alternative income streams. If not selling the Utah State Hospital's property, how else might we fund, sort of a more statewide mental health system that can get you the care that you get at the Utah State Hospital, but maybe in St. George or wherever. And so, yeah, he didn't want to give me too much there, wanted to save it for the session, but said they would be looking at these different financial streams.
At least some of the officials are looking at the model that's already happened, right? Moving the state prison.
They
want to follow that model.
If that's what Hawkins had proposed in 2023, it was the same sort of deal, like where the Utah State Prison was in Draper. I mean, that's highly coveted land. They get a committee together, look at different sites, and then they ultimately choose one that's maybe on less coveted land, and then they can start developing that. And so that's what Hawkins had envisioned. But it's like, I think we need to see just sort of the feasibility of something like that, which is, I think, what Clancy's study is looking at before they would put together a commission, or anything. And if they go alternate revenue streams, then maybe they don't even need to sell the state hospital land, so.
Any word from advocates like the Disability Law Center or families weighing in one way or the other?
No, I haven't talked to any of those folks, and I intended to, because it just makes sense to look at who this would impact, and so I think that's on my to-do list, my reporting to-do list, is to talk to the people that would be impacted, or people who went to UVU or something and interned there, and it was really valuable, and where they wouldn't be able to do the same thing if it was in Cedar City, or something. So yeah, that's on the reporting plan, but I haven't yet done it.
All right, we'll look forward to that. We're talking with Salt Lake Tribune reporter Paighten Harkins. Let's move to Utah Lake. You'd been doing a lot of reporting on Utah Lake. The officials there have been trying to improve the reputation of the lake, right? And get more tourists in, more visitors in. I guess first, let's removing carp and other things, right?
Hmm.
Before we get to that, there's some very recent news. I guess maybe on the bad side of the ledger.
Yeah, yeah. And so it's like, this I guess it was spring, but kind of this summer, the Utah Lake Authority had, put together this campaign where they were, telling people Utah Lake has a stigma about it. It has stigma of being polluted, just kind of gross is how people, had kind of described it. And part of that issue was, it had all these issues with harmful algal blooms and stuff. And so Utah Lake Authority did this campaign trying to get people back, talk about how much better the water quality is and all this stuff. And then I found out today that there is a lake-wide sort of harmful algal bloom over the lake, and so they're asking people to, don't swim, don't let your dog swim, try not to have contact with the water. You can still be on boats and you can still fish, but they say like discard the fish's skin and its guts and stuff like that. And so, some of the problems at Utah Lake, you know, these are going to persist, is what they tell me, until they can fix the problem completely. And they're doing a lot to do that. Like you mentioned, the carp, getting rid of the carp and things like that. So yeah, they're telling me that this is a normal occurrence. They're trying to make it happen less. Apparently it is happening less, but right now we have a Utah lake that you can't swim in.
Mm. How long is this going to last? Do we know?
I don't know. I
Mm-hmm.
think that, weeks to months, maybe
Oh,
even the
really?
rest of the,
Yeah.
yeah.
And so you're
Just looking,
not supposed to
oh,
swim
sorry.
in any part of the lake, or?
Yeah, that's what it seems like. I mean,
Mm-hmm.
if you go to the Department of Environmental Quality's sort of dashboard, they show there's like 16 or 17 monitoring locations around the lake. And so you can see they're all like these yellow caution signs right now, which are a
Mm-hmm.
health watch. And so I'm kind of looking to see if they upgrade those to warnings, in which case there's, a little bit stricter, I think a little bit stricter, caution being urged and stuff like that. But yeah, as much as Utah Lake is improving, this is still something they're going to have to deal with as long as, as long as the lake is as shallow as it is, the
Mm-hmm.
summers are as hot as it is, and there's still, carp and other things kicking up phosphorus and nitrogen for algae to feed on. So
I see. So if we get rid of more carp, that might help, and get more water in the lake. I guess it could help.
or yeah, less nutrient dense water,
Okay.
which the
Yeah.
Provo has a new water treatment plant that they think should help with that, but it's just kind of weird timing, it's
Mm-hmm.
like they did this, but they, had to expect it. This was going to happen. You would expect it kind of every year. So
Yeah. Can you still boat? It's not
yeah,
supposed to
so
swim?
far,
Okay. Yeah.
yeah, they don't want you to have contact with the water, but if you're, out there on your boat or whatever, fishing, or they, don't water ski because you might touch the water, but
Yeah.
yeah.
Okay. Well, yeah, that's bad news. I guess on the good news side, it seems like they are making some progress, getting more carp out, et cetera, the water treatment, et cetera.
Hmm.
The Utah Lake Authority just did a tourism study. Tell me a little bit about that.
Yeah, because it was, as they embarked on this mission to kind of get people back to the lake, they realized they didn't really have a baseline. They didn't really know how many people were coming to the lake. They didn't understand how many dollars were being spent there and all this stuff. And so they commissioned a study this year and got the results back earlier this week. And they found that an estimated 74.3 million was being spent on, and these are just out of county visitors too. So this doesn't count, the person who lives in Highland and goes, down the street or whatever to go to the lake. These are people that are traveling a little bit further, and they're spending, $74.3 million last year on lodging, food, boat rentals, Utah Lake shirts, or whatever, yeah. So gives them a bit of a, just a baseline to kind of, if they want to grow this, just check in to see how they're doing.
Hmm. They think they can at least double the visitorship, right?
I
Maybe
think,
more.
yeah, I mean, I think that, yeah, I mean, I can't remember exactly if it said double, but they certainly think that they can increase it, just
Mm-hmm.
through this campaign. It seems, the Utah Lake Authority was telling me that a lot of more local people have come, just anecdotally. And I know that they've been working on installing sort of like automatic counters at the different marinas and entry points and stuff like that. And so it's like, we'll have a way more, um, you know, comprehensive look at visitorship and stuff later. But I mean, they certainly, I think they can get the amount spent up. I was talking to the Utah Lake director, and he said, we could maybe get $1 billion.
Yeah, I think the Great Salt Lakes is approaching $2 billion. So
Yeah.
they hope they can get at least half that. Yeah.
Yeah, and the difference, and part of the difference there is that so much of Great Salt Lake's, the dollars it generates are from industry, like the brine shrimp industry or, all the other sort of, oh, not necessarily super duper environmentally friendly uh, businesses they do out there. And so when I was talking to the Utah Lake Authority, they were saying that their main focus is making sure that this lake is healthy. The water is maybe one day going to be clear, and stuff like that. And so it's like they don't necessarily want to have as many economic engines on the lake, is the point I'm trying to make. But they think through tourism and maybe some other smaller industries or something, they could get it up to 1 billion.
Well, I'm sure you'll be reporting more on this and
Yeah.
what progress is being made here. Thanks for telling us about these stories. We've been talking with Salt Lake Tribune reporter Paighten Harkins. Thank you.
Thank you so much.
And thanks, everyone, for listening to Behind the Headlines, the weekly news roundup from Utah Public Radio and the Salt Lake Tribune. I'm Tom Williams. Hope you'll be with me again next time.